David, why should people come here instead of any other offices?
I have a passion for creating positive results. I have a passion for doing noses. I'm a sculptor at heart. I am an artist at heart, and I know what balance is. And balance means bringing you the nose or bringing the patient the nose that fits their face. We're not looking for any cookie cutter solutions. Everyone's nose fits their face, except when people are uncomfortable with their noses, it tends to be out of balance. So sometimes the dorsum is too high, the tip isn't rotated enough, or it's too heavy, and that's what we really look at. When we get a CAT scan to look at the facial structures, that helps us identify the asymmetries that are in the facial bones, and that helps us determine how straight we can make the nose and where it will fit best in the face. Ultimately, what I want is I want you to be happy. I want you to have the cast off and say, this is fantastic. That's really what drives our passion to make our patients happy. But every patient's different. Every patient needs to understand what is possible. We need to hear what they want, and when those two discussions match, we end up with great results and a happy patient, which is ultimately what makes us want to come to work every day. The opportunity to talk to our patients and bring a sense of comfort and happiness and a solution to something that's bothering them. When someone comes in with an itchy ear, they want to know when they leave the ear is going to feel better. When someone comes with a nosebleed, they want to know that the nosebleed is taken care of. We as ENT doctors and myself as an otolaryngologist fully am capable of taking care of all the issues of your nose, whether it's breathing, if it's nosebleeds, if it's sneezing, if it's congestion, if it's a sense of pressure in your midface. On top of that, we're able to handle the cosmetic aspects of the nose as well. I understand by looking at 35 years of noses what can be done with a nose and what's realistic, and my ability to communicate the realistic expectations to the patient to help you understand what I can do, and in fact what anyone can do, brings a sense of confidence and a sense of certainty to the outcome. We spend a lot of time, I spend many hours talking to my patients. It's usually not in one visit, it's usually in 2 visits. We never take photos on the first visit because I want our patients, I want you to think about what I've spoken to you about, that I've heard your concerns and you've heard what I've thought. And on the second visit, that's when we take the photographs. And on the third visit, we go over the photos. Each session that we meet when we talk about your nose is designed to give you a sense of education, to give you a sense of understanding, because in the end, we want you to be happy with the result. And in the end, all the discussions bring us to a place when the cast comes off, you know what you're going to get. And that's part of the excitement. The difference between being nervous about a nasal surgery and being excited is the preparedness that we make sure you go through. So that when you have the day of your operation and you're looking forward to it, you know you have an idea of what we're going to accomplish. And that brings the anxiety down, it brings the excitement up. We want to minimize the anxiety of surgery. Surgery, of course, is anxiety provoking because it has anesthesia and all these other features. But by preparing you, by educating you to every step of the process, when you know that I'm going to be there every step of the way, that I'm available by phone, that it's not just bringing you to the operating room, but it's afterwards. We see you within a day or 2 to make sure you're okay. We see you a week later to take the cast off. We see you a week after that to make sure the sutures are coming out appropriately. The sutures are dissolvable, but sometimes if something gets a little hung up, if the suture gets a little clogged with some mucus, we're there to take care of you. I don't use PAs, I don't use nurse practitioners. You get me because I care about you. I want you to be happy, and I want you to say a month afterwards, this was a great experience, that Dr. Seidman cared about me. My patients say that. You can watch our videos online. It's a consistent theme in our office. My passion to take care of you, to give you a great result, doesn't only make you happy, but it makes me happy. Your completion is my completion, and that's what we strive for. Every patient is individually taken care of by me. Every patient is cared for post-operatively by me. And when we see you at 3 months and at 6 months and we look at the photos, all my patients are happy. And that's our goal. When you're happy, we're happy. And your satisfaction with your nose and the sense, when you look at your nose a month later, you're going to forget what your nose looked like beforehand, because you're going to say, this is my nose. This is how my nose has always looked. And when I take out your preoperative pictures and you look at them and you say, oh my goodness, this is so different. I don't remember it looking this way. That's because you've already moved into the new look, which was always the way you saw yourself. And that's what we're here to do. We're here to bring balance. All great art is really about composition, and all great faces are composed in a balanced way. Yes, they're still asymmetrical. There's a little difference to left and right. We all know that. Great artists like Picasso knew that too. It's a matter of bringing the nose into balance with the rest of the face. Harmony is beauty, and symmetry, when we can bring it, brings the highest level of that. People say to me, well, maybe I'll do my nose, maybe I won't. But I know in my heart, once a person thinks about their nose, once a person feels uncomfortable with their nose, or once a person says, I don't like this about my nose, I know they're going to repair that asymmetry or that imbalance. It's just a matter of, is it this year or is it next year? So when people come in and they say, well, I'd like to talk about my nose, there's no rush. Our job is to educate and tell people what they can want, what's possible. Our job is to help people see what's possible. And most of the time, when people have done their shopping, they realize we speak their language. We've reached them in a way that they understand, and we can produce the results. And people come back to us. People come back to us at 6 months. Hold on a second.